My name is Leslie, and I'm watching Vanessa's presentation.
Hi everyone, my name is Vanessa Mundy. I wanted to thank everyone for being here today with me. I wanted to discuss a topic that I personally know a lot about, which is lupus. Some people may have heard of it, some people may have not. I wanted to provide you with information and let you know more about it, give you more details about it. So I know you heard of celebrities such as Nick Cannon, Lady Gaga, Selena Gomez, Toni Braxton. Believe it or not, they are all diagnosed with lupus. Nick Cannon had mentioned, he had a quote that he said, "Initially, I did not want to believe the diagnosis because I know what having this meant for my life." And I personally can relate to that. I am diagnosed with lupus. Every day is a battle for me. There are some good days, there are some bad days. There are days where I'm experiencing joint pain, stiffness, inflammation, fatigue, brain fog. I am sensitive towards light. I have hair loss. Hair loss is a big one. That one is very common for me. So these are all the symptoms that are I experience on a daily. And it's not easy to deal with. It's very it's very rough, and it's something that I struggle with often. So I wanted to break down 3 major points that I'm going to talk about today. First one is the background of lupus. Second is the causes and the signs and the symptoms of lupus. And finally, the last one is the treatment options of lupus. So I have here a little presentation that I created. So let me begin it. So what is lupus? So lupus is a chronic autoimmune disease. So the system attacks healthy joints and organs in your body. So the skin, the joints, the heart, the lungs, the kidneys, all the brain, those are all affected. They're targeted by lupus. And they are the healthy joints, everything that's healthy, that's getting targeted by your immune system. So there are 4 different types of lupus. First one is SLE. That is the common lupus. That's what most people know much about, and that's the one that a lot of people are diagnosed with. Second is the cutaneous lupus. Cutaneous lupus affects the skin, just the skin. So third is the drug-induced lupus. So that is where certain medications, like heart medications that a person takes, they can affect you, and you can develop lupus over time. Fourth is neonatal lupus, which is when a mother passes down antibodies to their newborn and they develop lupus. So that one, the fourth type of lupus, that one is the least common. The SLE is definitely the most common one out of all of them. So I have here an image of a woman. She has a butterfly rash across her cheeks and her nose. So she is that's definitely a sign of lupus, and I'm going to talk about it a little bit more when I get to that slide. So, causes. There are no known causes of lupus, but there are some triggers that can cause lupus. So, such as the first one is environmental factors. So, such as the sunlight, UV rays can trigger lupus, can cause it. Genetics. So, such as your mother or father, they can have lupus or maybe pass it down to you, but that might not happen in every situation. Because personally, with myself, my parents do not have lupus, and I currently have it, so that doesn't necessarily work for me. That's not what I'm relating to. Hormones. That is one. So women normally they have a higher estrogen level than men, so that's why women they're more prone to lupus than men are. Medications, like I mentioned before, heart medications, certain heart medications can cause lupus over time. So, next slide. So I have symptoms and signs. So the following symptoms and signs. So we have fatigue, joint pain, swelling or stiffness, butterfly rash, like I mentioned in the first slide with the woman with the rash across her cheeks and her nose, hair loss, light sensitivity, shortness of breath, fever, headaches, and forgetfulness. People don't normally know this, but like your mental health is affected by lupus. You can get depression, anxiety from lupus. So those are all the known symptoms and signs. And I have an image here just showing all the symptoms, certain organs that are affected, areas of the body that are affected by lupus. Lastly, the main point is treatment. So doctors may prescribe different treatment options based on your symptoms. So first one is steroids. So prednisone is an option for a person who may have swelling or inflammation. Second is anti-inflammatory medications that works to reduce swelling as well. But examples are Adleve, Advil, Motrin. Pain relievers is another one, which is an example is ibuprofen. I got prescribed ibuprofen from a doctor before. Anti-malarials such as hydroxychloroquine. That one is, I know that's a very popular one because of COVID. They mentioned that before, and I know people might be familiar with that medication. Okay, and then the last slide, I just have celebrities that I talked about in the beginning. Nick Cannon, Lady Gaga, Toni Braxton, and Selena Gomez that all have lupus. So I hope everyone has gained knowledge about lupus and can pass it down to your loved ones and any friends, anyone who is experiencing it. Maybe it's yourself. I really hope that this presentation has provided you with the information you needed. Thank you, everyone.